Hi, so you've received your progesterone prescription. My name is Grace Meehan and I'm a pharmacist. I'm also a certified menopause practitioner with the Menopause Society, and I'd like to go over some counseling tips for you so that you know how to use this and you'll get the best effect with it. Your prescriber has prescribed progesterone for your specific symptoms. What I can tell you, it has favorable effects in many regards. For instance, it's helpful in perimenopause to help regulate the menstrual cycle. It can help with PMS symptoms. It can help to balance out high estrogen levels, which can happen in perimenopause. And it also has great effects on mood, like irritability and sleep. In a postmenopausal woman, progesterone is used to balance out estrogen. Because estrogen can thicken the lining of the uterus in a woman who still has an intact uterus, progesterone is used to keep the lining of the uterus from getting too thick. Plus, in that woman, it will also have the favorable side effects of helping with sleep, helping with mood and anxiety. It can also even help with bone health. Progesterone can be taken in one of two ways. It can be taken as oral capsules, or it can also be taken as a cream. Let's talk about the oral capsules first. If you've been prescribed progesterone by mouth, be sure to read your prescription label first so you know what your dosage is. Progesterone is always taken at bedtime because it can have that positive effect on sleep. That's so wonderful. So take it at bed. It can be taken with or without food. You may have been prescribed a progesterone compounded cream. Progesterone cream can come in a variety of devices, which I'll show you how to use in a moment. When you are applying progesterone cream, it's applied to these areas: to the thin skin of the inner arm or the thin skin of the inner thigh. It can even be applied behind the knee. It prefers thin skin for absorption. Wash your hands before you apply. Now, if you're using the metered dose pump, it looks like this. Read your label first, remove the cap. If it's the very first time you're going to use it, you're going to prime the pump, which means give a little push on this until you see a little bit of cream come out. Then you can apply your dose to that thin skin of the inner arm, or the thin skin of the inner thigh, or the thin skin behind the knee. Give it a good rub so that the cream absorbs in and you're not left with a lot of residue there. Wash your hands after application, and please avoid swimming, bathing, or showering within at least an hour after application. Avoid skin-to-skin contact with anyone else or with a pet for at least 4 hours. Your compounded progesterone cream may come in a device like this. This is called a top-a-click. Read your label so that you know what your dose is that you're going to apply. Pop off the cap. It'll say how many clicks that you're going to apply. For instance, if I was to apply 1 click of this cream, I would hold it by the barrel, move the base till you see the cream come up. That was 1 click. Then I could put it on the thin skin of my inner arm, or thin skin of inner thigh, or behind the knee. Give it a good rub in so you're not left with a lot of cream residue. Wash your hands after you've applied and pop that lid back on. This is kept at room temperature, as are all progesterone products. You may have received your progesterone prescription in a little pot like this with a syringe. It may be that either your prescriber or you chose this way. How to use this? Number 1, read your prescription label first so you know how many mils of cream you're going to apply. Take the top off the pot and set the pot down on the table. I'm going to say my dose was, say, 0.5 of a milliliter. What I'm going to do is I'm going to pull the plunger of the syringe down to the 0.5 mark. Then I'm going to insert this into the hole of the pot and push that 0.5 mils of air in. This is important now. Remove the plunger. Put the plunger back into the product and push to get that 0.5 mils up. Now I've overshot, and that's okay. I'm going to put the plunger back in and push it down to the 0.5 mil mark, and now I'm ready to go. Remove the syringe from the pot, and you can apply it to the thin skin of the inner arm, inner thigh, or back of knee, and give it a good rub in, leaving no real cream residue on the skin. Okay, a really good rub in. Wash your hands well and put the top back on the product. And this is to be kept at room temperature. Regardless of the device that your progesterone prescription came in, it's important that you know to rotate the site of application of the cream. For instance, if you've used the inner arm of your left hand for one application, use the inner arm of your right hand next time, etc. That allows your skin to breathe and you're less likely to have any skin irritation. You might be wondering if there are any side effects with progesterone. Well, generally it's a very well tolerated product, but there can be, like anything else, there can be some side effects. Some women will experience some breast tenderness or almost like a heaviness in their breasts. Some women will experience constipation, sometimes some mood changes, or some bloat, some gastrointestinal bloat. If you're experiencing something that you're not sure of, then give our pharmacy team a call or to speak to your prescriber. In women who are using progesterone premenopausally, they may experience an alteration in their cycle length. For instance, their period may come a little bit earlier than they were expecting. In perimenopausal women, progesterone can increase fertility as well, so it's important to note that. If you're experiencing a side effect or wondering if what you're experiencing is a side effect of progesterone, please give our pharmacy team a call or you can speak to your prescriber. And finally, congratulations on taking control of your menopausal health.